The lumbar multifidi. What is it? Hey, we're here at Championship Chiropractic, and we're here with Dr. Donald Ozello, and we're going to talk all about lumbar multifidi. What is it, Doc?
Well, thank you very much. That's an excellent question. The multifidi muscles are the deep muscles in the spine. They perform extension, which is bending the spine backwards. Just like we spoke about in a previous video about strengthening the deeper core muscles, strengthening the deeper spinal muscles is extremely important. The lumbar multifidi muscles are shorter muscles that connect one vertebrae to the next. And what they do is they perform the motion of extension, but they also help to stabilize the spine.
Wow, okay, movement and stabilization. So obviously very important to your lower back. So how can we strengthen the muscle?
Well, strengthening the muscle is extremely important because if the multifidi muscles are weak, the larger muscles, like the erector spinae muscles, they have to work harder to stabilize the spine. And those muscles are more for motion than they are for stabilization. So if the multifidi muscles are weak, that puts a greater workload on the surrounding muscles. And those muscles fatigue faster, and that's how they become injured. So strengthening exercises that work the best for the multifidi are when you're laying prone, you could do it on the floor, or you could do it on a fitball if you're a little bit advanced. You could do it on an exercise bench. It's just bending backwards at the lumbar spine. So you move backwards into extension, you move slowly, and you hold an isometric contraction for 2 to 6 seconds. When you start, you don't want to start with the isometric contraction because you may just be learning the motion. But you build to an isometric contraction, start with a 2-second hold, build to a 6-second hold because that helps to build strength and endurance. Now you always want to remember that you always want to perform all exercises through a symptom-free range of motion. Even if that motion is tiny, you want to perform all exercises through a symptom-free range of motion and never perform an exercise that elicits or intensifies symptoms. Because there are some conditions that bending backwards is very, very painful. So you don't want to perform that. But if you just have weakness in these muscles, or if you want to strengthen the multifidi muscles as a preventative, then you want to use the lumbar extension exercise.
And by symptoms, you mean any type of pain or discomfort?
Of course, yeah. It could be dull, achy pain. It can be a deep type of a pain. It can be sharp shooting pain, numbness, tingling, any type of symptoms like that. If you feel that while you're performing an exercise, stop that exercise immediately and find a viable substitute.
And it sounds like creating strength and endurance is what's important with these exercises.
Oh, most definitely, most definitely. Because you figure many times we will sit for long hours during the day and the muscles start to fatigue. So having endurance in those muscles is extremely important.
Like we talk about in a lot of these videos, your kinetic chain, everything is connected. And when we talked about the deep core muscles, I take it they're connected to your lumbar multifidi muscles. So take care of yourself. Watch the other videos. Thanks, Doc.
Thank you, James. Thank you, everybody. Thank you, everybody, for watching today's video on spine health. If you have questions, feedback, or suggestions, you can leave them in the comment section below. Please feel free to like this video, and please subscribe to my YouTube page, Dr. Donald A. Ozello, DC. You can also visit my website, championshipchiropractic.com, where you can see my blog, which contains articles on sports medicine, chiropractic, health, fitness, and nutrition. Thanks again for watching today's video.